Hi, good day. My name is Massey. I'm Baling from BSN2-WIEDENBACH. For today's video, I am going to show you the procedure about applying cold therapy. But what is the definition? It is the local application of cold to the prescribed area with the use of crushed ice. And what are the objectives? Number 1 is to promote vasoconstriction. Number 2 is to decrease edema. Number 3 is to reduce pain. Number 4 is to decrease temperature. And last is to decrease or stop the bleeding. Now, let us proceed to the procedures.
Step number 1 is to review the physician's order for the application of cold therapy, including frequency, type of therapy, body area to be treated, and length of time for the application. Reviewing the order validates the correct patient and the correct procedure. Step number 2. Gather the necessary supplies. Preparation promotes efficient time management and provides an organized approach to the task. Step number 3. Identify the patient. Determine if the patient has any previous adverse reaction to cold therapy. This ensures the right patient receives the right intervention, and individual differences exist in tolerating specific therapies. Step number 4. Explain the procedure to the patient. Discussion and explanation help allay anxiety, encourage cooperation, and prepare the patient for what to expect. Next is to assess the condition of the skin where the ice is to be applied. Assessment supplies baseline data for post-treatment comparison and identifies any conditions that may contraindicate the application. After that, perform hand hygiene. Hand hygiene prevents the spread of microorganisms. Next is to close the room door or curtains and place the bed at a comfortable working height. Closing the door or curtains provides privacy, and proper bed positioning helps reduce back strain while you perform the procedure. Next is to assist the patient to a comfortable position that provides easy access to the area to be treated. Expose the area and drape the patient with bath blanket if needed. Put the waterproof pad under the wound area if necessary. Patient positioning and use of a bath blanket provide comfort and warmth. Waterproof pad protects the patient and the bed linings. Step number 9 is to prepare the device. Fill the bag, collar, or glove about 3/4 full with ice. Remove any excess air from the device. Securely fasten the end of the bag or collar and tie the end glove closed, checking for holes and leakage of water. Ice provides a cold-safe process, and excess air interferes with cold conduction. Fastening the end prevents leaks. Next is to cover the device with a towel or washcloth. The cover protects the skin and absorbs condensation. Next is to position cooling device on top of dressing and lightly secure in place as needed. Leaving the dressing in place prevents the spread of microorganisms, and proper positioning ensures the cold therapy to the specific area of the body. After that, remove the ice and assess the site for redness after 30 seconds. Ask the patient about the presence of burning sensations because these actions prevent burn injury. Next step is to replace the device snugly against the site if no problems are evident. Secure it in place with gauze wrap or tape. Wrapping or taping stabilizes the device in the proper location. Next is to reassess the treatment area every 5 minutes or according to facility policy. Assessment of the patient's skin necessary for early detection of adverse effects, thereby allowing prompt intervention to avoid complications. After 20 minutes or the prescribed amount of time, remove the ice and dry the skin. Limiting the time of application prevents injury due to overexposure to cold. Prolonged application of cold may result in decreased blood flow with resulting tissue ischemia. A compensatory vasodilation or rebound phenomenon may occur as a means to provide warmth to the area. Next step is to apply a new dressing to site if necessary. Dressing provides protection to the skin. After all the procedure, the nurse should perform hand hygiene because hand hygiene deters the spread of microorganisms.